At 39 weeks, Brian and I went in for our final ultrasound. The technician quickly told us that there was an issue. Our daughter was in serious trouble for sure. We were crushed beyond belief because we knew that the next time we were going to see her, she was going to be whisked away from me. That moment of being so terrified, I also felt really confident that we were going to a good place, that they were going to take care of her.
As a mother of a child who was born premature myself, I definitely understand the emotional roller coaster ride that a parent feels. It's very nice to know that we have the assistance and the expertise of the Children's Hospital staff and physician team to help coordinate the care of those patients. As soon as baby is delivered, I can get baby to the specialist team and they can take care of the baby while I immediately go back to the mother.
It was just amazing to look to my side and see all in one room the mother and child were being cared for, and it gave me the confidence to know that she was going to be okay. Faith was up in the neonatal immediate care unit. The nurse appeared with this beautiful photograph. It was this gorgeous photo of my new daughter, Faith. I wasn't able to see her for several hours after she was born. And that's one small thing that nurse did for me. That meant the world to me.
I'm Joan Rickley, and I'm the Director of Neonatal Services at DeVos Children's Hospital. This is the largest NICU in the state, and we have about 200 staff nurses, so it's quite a large team. The neonatal intensive care unit is almost like its own little city inside of the Children's Hospital. We're very fortunate in that we have every kind of subspecialist for pediatrics that you can think of here, and so we're really able to provide services to families from this part of the state that otherwise they would have to go to the Detroit area or to Ann Arbor for.
The neurosurgeon, Dr. Lawrence Foodie, came into our room. My parents were there with us to support us and to hear the news for the first time that Faith actually suffered a stroke in utero at around 35 weeks. That blow to us was shocking and very scary because I've never heard of that before. None of us had.
Dr. Foodie came and described and made sure we understood exactly what was happening, and then he said, you know, I'm gonna begin to take her down in about a minute or two, and I'll give you 2 or 3 minutes. And then the really hard part was when they actually rolled her away. And I'll never forget her just kind of rolling down, and then the doors closing, and he just hoped she'd come back.
Folks who work in a neonatal unit are unique individuals. They are around crisis all the time. They also are intimately involved with families for a long period of time, much more so than you might see in other kinds of medical settings. An average family spends 30 days in our unit. And the staff that works here finds out really quickly if this is their passion or not. We don't save every baby. We have babies that are too small or too sick. And for some folks, that's too hard for them to handle. But for many staff who work here, that's an important part of their work. And even in that sad situation, they have something to give, to offer to that family, to help them through that, to create some memories that will last for a lifetime that they have without that child.
And after my mother and I finished entire rosary, Dr. Foodie came in and told us that the surgery went as expected. There were no surprises, and so that was a huge relief. and that we could go see her immediately. I didn't want to interrupt the nurses because they were so busy attending to Faith, and they encouraged me immediately to say, no, you can hold her hand, no, you can touch her.
I'd never been in a NICU before. I just remember being jarred by just the technology that supported all these little lives.
I see a lot of dads who stand way off and they're afraid of that teeny little baby with all those monitors connected and all the lights and all the noise, and they really have to be told it's okay, you know, it's okay to be afraid, it's okay to touch.
How can a 2-pound infant even, how do they pull through this stuff? And they just, the nurses will just tell you they're wired to go. They are wired to live and they're wired to grow.
I believe that all our babies have the fight, the will to live, to get better.
Hannah and Madeline were so eager to see their new little sister. And you might expect that the nurses wouldn't want to have anything disrupt the sterile environment that these babies so desperately need. And that wasn't a problem at all.
I remember when she was in the hospital, when we went to go and see her the first time, which was really cool.
The nurses allowed them to hold Faith and kiss her and rub her cheeks and allow for that special moment with her new little sister.
He always put pictures of us with her, or pictures of us, just us, on her crib on the side.
We've learned more probably from Hannah, who's 7, than anybody else in this whole experience. She has been the best big sister. Hannah's main concern for Faith in this whole process, just that she didn't ever want to think that Faith was in pain. That was her. If she thought that Faith was comfortable and not in pain, she could get her head around a lot of other stuff. And Hannah's been a great example of just a day at a time. Don't complain. Love your family.
We have families that are here day in and day out for 6 months in a row, and they go through a little bit of withdrawal when they go home. Sometimes they'll call us in the middle of the night because they'll know we're here and that we're up and that they're not bothering anybody, just to ask a question about something that they're wondering. So we just really form close relationships with families, and we miss them when they're gone. It's a happy day for us, a happy day for the family, but those relationships really go on after they go home.